Hello. Thank you very much for being with us at this time of dinner. I'm the first speaker. That's why I will present a general overview to the adolescent pregnancy in Turkey and foreign countries. In recent decade, there's a decrease on the adolescent pregnancy rates. Still, it is a big social problem for us. It is an interest area of everyone, from state to physicians. Pregnancies below the age 15 are called as adolescent pregnancy. Each year 1 million adolescents deliver babies. It is 1 out of 5 births, and it is not something that we can ignore or underestimate. And the majority of these births are delivered in less developed or developing countries. This is World Health Organization 2015 data. Birth prevalence between 15 to 19 is 49%. It can change from 1 per mile to 99.9%. In the United States, the rate is not lower that much. In some cases, we see 84 per mile, 94 per mile. Especially Latin Americans and Afro-Americans have a higher rate of pregnancies during adolescence period. And we can understand that it is very much related to socio-economic situation of an individual. Japan and many Western European countries have less rate in terms of pregnancy. But in the European Union, Belarus, Bulgaria, Romania and Russia has higher adolescent pregnancy rates than other countries. We can see abortion rates along with the pregnancy. Each year, 3 million adolescents get abortion with insecure ways. In Turkey, what is the situation? In recent years, there's been decrease. It was per 43 per mile, but it recessed back to 39 per mile in 10 years of time. And here you can see where the dominance of adolescent pregnancy is. Trabzon, Rize, Tunceli is the least frequent pregnancy places. In the pregnancy period, there are certain relations changing, such as sexual relations, and also there is imbalance between gender and power. And adolescence puberty period children can get irrational decisions, and they have very weakened communication. They have fear being rejected, so these are increasing the possibility of a person to get pregnant. What are the preventive factors? If there's a good relation between parents and adolescent, if there is good supervision of the parent, if there are expectations of the adolescents for future, they can be deemed as preventive factors from the pregnancy for the adolescents. What are the risks? There are certain psychosocial factors. We know that low education level is very important, and low income level, and also living in a very sophisticated area, and having a divorced parent or very crowded families, especially not having father for a long time, is a big risk factor, or having an adolescent mother as well in the family is an example. And substance abuse, mental disorder, bipolar, schizophrenia, depression increases the pregnancy possibility for 3 times than the normal population. And low self-esteem, self-confidence, high stress, and also child age marriages and sexual abuse, sexual harassment. Adolescents cultural features are also important, and coping mechanisms with stress is very crucial for the adolescents, especially in less developed countries. When you get pregnant as an adolescent, you can be accepted more easily. Having a mother is always confirmed. It is something appreciated by the society, no matter what age of a mother. So an adolescent, no matter what age of her, is acceptable even if she has to drop the school. These children can grow up under this culture and the situation can be normalized, but for some societies the opposite can be available, and some adolescents want to have a baby in order to stabilize their chaotic lives. In the United States and European countries, there are many studies done in that frame. Some adolescents want to get away from their families, want to drop the school, want to have an attachment to someone, want to establish a relationship or save their relationship or get a purpose for their life. So they want to show how responsible they are by getting pregnant, and also getting pregnant has positive impact on substance usage as quittance. In Australia, there is this study about adolescents' pregnancy. Adolescents think that they can take responsibility and they can see future is full of hope, and they want to be better moms than their own moms. This is very discussable issues because there are rare examples like this, and it is open to discussion. These adolescents, whether they can be better mothers than their own mothers, do they feel ready for being a mother, or to what extent they are really ready to be a mother. Next presentations will take this as a discussion matter. Embodied meanings of early child bearing among American Indian women, a turning point. Many women felt that they were desperate and they were hopeless, and they explained that they were trying to hide their pregnancy. In the adolescence period, adolescents generally want to hide their pregnancy. She, at this example, tells how she rejected her situation. Even her belly became very big at the last moment of the pregnancy. That woman rejected her situation because she felt that she lost her future. And I would like to say a few words about child age marriages, early age marriages, because this is important for us, especially in less developed countries or developing countries. More than 30% of girls get married before the age of 18, and 14% of girls get married before the age of 15. According to Turkish statistics, 90% of mothers, adolescent mothers, are officially married. And based on this data, we can understand that majority of these adolescent mothers, up to 50-55% of them, are 15 to 19 years old. And generally, girls get married, or girls are forced to get married to older guys. It is prohibited for the adolescents younger than 18, but still we can see many examples. In developing countries, biggest cause of it is poverty. Sometimes families feel that their daughters are a burden to them. Sometimes they are forcing their daughters to get married so that she can live in a more prosperous environment. And sometimes we know that In some cultures, marriage is thought to be a protector from sexual harassment, but pregnancy risk increases for adolescents, and unfortunately, these girls are confronting with big complications caused by pregnancy. And early childbearing related complications are the most important causes for premature mortality, especially crisis periods and migrations. These are very important for that risk after steering crisis. Early age marriages, child age marriages, and adolescent pregnancies have increased. It is a vicious cycle. It is a vicious circle, and it continues. When they get married at an early age, they are actually poor because they cannot continue to get education. They are in need of social aid, and that vicious cycle becomes unbreakable. And the child born under that circumstances is equipped with risks because that baby's mother is an adolescent as well. And in the future that baby can be an adolescent parent. And pregnancy is not necessarily associated with marriage. In Latin American countries, without marriage, pregnancy can be seen very frequently. In addition to psychosocial activities, sexual activity habits of an adolescent must be touched upon. Some risk factors for sexual activities is frequent and early sexual activity. Onset of sexual activity is 16 for boys, for girls it is 17. There is no data which proves the decreased age of sexual activity onset by the World Health Organization statements. We know this, but early puberty is a very important factor because it brings early onset of sexual activity and it increases frequent sexual activity and risky sexual behaviors, multi-partners or insufficient sexual education. Multi-partner of adolescents is not very frequent, it is up to 40%, but we know that adolescents have shorter relationships in terms of time, and they may change their partners very frequently, and they are not equipped with information in terms of birth control, or they cannot even access the birth control. And there is insufficient information about sexuality and family planning. There is nothing for me to say further things because it is obvious. Even it is taboo for families to discuss this. In our country, there are not any educational or training programs that are structured for adolescents. Misbeliefs and misinformation can be seen very considerably among even medical students. Hacettepe University medical students, 73% of them believes that if the first pregnancy is ended with an abortion, it ends up with infertilization. In terms of contraception, I would like to say a few words. Contraception usage increased among adolescents. Usage of condoms and multi-contraceptive drugs usage increased. Oral contraceptive is a bit more risky because girls do not get their drugs on a regular basis. They don't go to control examinations on a regular basis. In terms of access to information, they may have difficulties. Sometimes they are not aware of the situation, and sometimes they don't know whom to ask these kind of questions, and they may feel shy or ashamed if they want to ask a question, and they are getting away from the stigmatization of the health care staff. We should not judge these adolescents, but we need to work in an organized manner in order to increase their awareness. And not only sexual training or sexual education, but also general education level is important, because when the education level gets lower, the possibility of getting pregnant during adolescence period is increasing. There is insufficient information and unprotected sexual intercourse, and when this is the situation, adolescents can get pregnant easily. Adolescents have not finalized their development, that's why their obstetric risks are higher. Maternal mortality rate between 20 to 29 years of age is 2 times higher compared to other ages. There can be some complications with respect to baby or neonatal, such as premature delivery or low birth weight and infections, chemical dependence, addiction, and maternal complications, anemia. 70 to 80% pregnancies come from these adolescence periods, are accompanied with anemia and hypertension and hemorrhagia, eclampsia, because their pelvis is not advanced, and interventional vaginal birth is seen very frequently. I don't have time, so this is my last words. I'd like to wrap it up. These are some challenges of adolescents. When you look at things together, they drop out of school, they discontinue school, they have to work, there are socioeconomic challenges, they get away distance from their friends, and there are some attachment and breastfeeding related problems. They have hostile behaviors against baby, they cannot get any support from their families. Stigmatization is very important. Insufficiency of self-esteem and domestic violence among the adolescent pregnancy is higher. Postpartum depression and anxiety is very crucial during adolescence period. Postpartum depression rate is 55-56%. It is too much when it is compared with adults. Postpartum depression, which is 10 to 15%, especially insecure attachment and insecure feelings and bodily image, anxious and sexual harassed adolescents can have higher postpartum depression possibilities. Abortion may bring post-traumatic stress disorder symptoms, and suicide thinking can occur, and also substance abuse is important. We should not underestimate the importance of it. So I'd like to wrap it up in general, and I will conclude my speech. Later on we are going to give you more details. If you have any questions, thank you very much.